how worried should I be about my kids going to school? So, this crosses different strata. It can be little kids who are going to daycare and preschool who are not able to even wear masks and are not necessarily the best at social distancing. It can include older kids who are going to elementary school or middle school who can wear masks and social distance but are not vaccinated. Kids over the age of 12 who may be vaccinated. So there's a lot of different kind of variations that we see. But, I think a lot of parents are very concerned about the fact that their kids are going to school. Many of them, their kids do not have the vaccine. And, this is in the intersection of the fact that we're going through a big surge right now with the Delta strain, which we know is very infectious and very contagious. So as I have these discussions with my families, one of the things that I emphasize is that there's no easy answers to this. And I think it's very important to individualize what you do for your family based on a host of factors. Is your child vaccinated or not? Can your child wear a mask or not? Are there other people at home that are vaccinated or not? Are there people at home that are immunocompromised? So I think there's a lot of different factors that we have to take into play. One of the other things as a pediatrician that I've definitely seen is the impact that COVID is having, not just on the physical health of children, but on their social and emotional health. So, as you said, Vidyangi, for some kids, this is the first year that they're even going to college. I'm sorry, not college, to school. I do have families that definitely their kids would have gone to daycare or preschool, and they have not been able to do so because of COVID. And we know that kids develop very rapidly. We know that kids love being around other kids. So all of us as pediatricians are concerned about the social and emotional ramifications that COVID is having on a child's development, given the fact that many kids have not been able to socialize and develop in the ways that they normally would. As I mentioned, with young kids not being able to go to daycare or preschool, older kids not being able to go to school. One subset that I think is getting kind of especially hit with COVID and the social and emotional effects of this, something that I see, as a pediatrician, is teenagers. So one of the things that's been really hard with COVID is feeling connected to other people, being able to have that social connection. Developmentally for teenagers, this is a stage in life where social connections are extremely important. Teenagers care a lot more about what their friends think sometimes than what their parents think. And the fact that we have teenagers who haven't been able to go to school and haven't been able to have sleepovers and haven't been able to play sports together, for a while, can cause significant impact in terms of their mental and emotional health. That's the reason that we've seen a huge uptake in terms of things like anxiety and depression, even suicidal behavior, unfortunately, in our youth. So, I think it's important for us to think about all the, kind of medical consequences that the COVID pandemic has had, not just physically, but also in terms of the social and emotional ramifications. In terms of COVID itself, just kind of broadly, one of the things that we do know, since we have been going through this pandemic for about a year and a half now, is that fortunately, kids do not tend to get nearly as severely affected with COVID as adults do. So we have more and more data that shows that kids definitely don't get hospitalized as often as adults do. Very fortunately, there's much lower rates of mortality for kids that get sick. So, I think the science is still unraveling the why, but, overall, kids do tend to fare much better with COVID infection than adults do, which I feel very grateful for as a pediatrician and also as a parent. But, that being said, there are cases of kids, unfortunately, who do get sick and, who have really bad outcomes. In my own personal experience, I do have several children during the past 18 months, several of my patients who have contracted COVID. I will say that not a single one of them has needed to be hospitalized. And I will say that many of them have done quite well with very mild symptoms. I read a statistic once that said that about 40% of kids who get COVID actually are asymptomatic, which is pretty amazing. So, fortunately, this does not overall tend to be a severe severe disease for kids. But of course, there are cases of kids who can get really sick. You may have heard about the MIS, multi-system inflammatory syndrome, which is, when kids get COVID and actually get quite ill. Fortunately, those cases are very, very rare, usually in like much younger kids, but, there are kids that can get quite sick from COVID.